Hey guys, welcome back to Medical Coding with Blue. Today's episode, I am going to be talking about the Cpma credential, or the Certified Professional Medical Auditor credential, offered with the American Academy of Professional Coders. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay, disclaimer first. This video is not an endorsement from me for this credential. I am simply fulfilling a request that was asked of me by a viewer. So I am going to explain what the Cpma credential is. I will also tell you that I am not affiliated with AAPC in any way. With AAPC, I do recommend their CPC credential, or the Certified Professional Coder credential, because that is one of the credentials that employers are looking for when they're looking for medical coders. I am a member of the American Health Information Management Association. I am currently certified through them. I have the Certified Coding Specialist Physician-Based credential. So let us begin. All right, that all out of the way. What is the Certified Professional Medical Auditor? It says, advance your career. This is according to the AAPC website. Advance your career with the Certified Professional Medical Auditor credential. Medical auditing is a critical piece to compliant and profitable physician practices. Whether it's a recovery audit, contractor, RAC audits, private payer denials, or just peace of mind, more physicians plan to have audits conducted regularly. The risks of being non-compliant with documentation and coding are too great. As a Cpma, you will be able to use your proven knowledge of coding and documentation guidelines to improve the revenue cycle of nearly all healthcare practices. And it says, certified Cpmas demonstrate expertise in medical documentation, fraud, abuse, and penalties for documentation and coding violations based on governmental guidelines, coding concepts, scope and statistical sampling methodologies, medical record auditing skills and abstraction ability, quality assurance and coding risk analysis, communication of results and findings, and the medical record. And covered on the exam, the Cpma exam, is 150 multiple choice questions proctored. 5 hours and 40 minutes to finish the exam. You get one free retake. It is $399. It is open book with the manuals. The Cpma exam thoroughly covers medical record standards and documentation guidelines, 26 questions about the medical record, HIPAA privacy and release of medical record information, covered entities, HIPAA privacy regulations, J-code documentation standards, record retention, the advanced beneficiary notification, legal requirements of the medical record, analyzing the operative report. It also covers coding and documentation compliance guidelines. It has 32 questions in this section: the compliance plan, fraud and abuse, civil monetary penalties law, Federal False Claims Act, the Stark type of audits, OIG regulations and work plan, National Correct Coding Initiative, CMS guidelines for E&M documentation, OIG imposed CIA or corporate integrity agreements, recovery audits, and other government programs. And then it covers coding and reimbursement concepts. There are 20 questions. CPT coding concepts, modifier usage, diagnosis coding and medical necessity, evaluation and management documentation guidelines, and then coding guidelines versus carrier guidelines. Scope and statistical sampling methodologies, 11 questions in the audit scope and statistical sampling. Medical record auditing abstraction. Audit cases including 52 questions, 24 audit cases. Evaluation and management, surgery, physical therapy, radiology, psychiatry, hematology, oncology, and infusion services, and category risk analysis and communication. 9 questions, validation of audit results, analysis and report of audit findings, communication Communicating audit results and corrective action. And then it says the majority of the questions are presented in multiple choice format, covering auditing theory, legal and regulatory issues, NCCI, RAC audits, statistical sampling, coding concepts, and modifiers, etc. In addition, each test taker will need to audit approximately 20 healthcare cases. Now, they do recommend that course requirements. While there is no requirement, we strongly recommend that the candidate have at least 2 years of experience in medical auditing. Please be aware that this is a difficult, high-level examination which is not meant for individuals with little, limited, or no auditing experience or training. And it says other requirements. We recommend having an associate's degree, pay examination fee at the time of application submission, maintain current membership with the Aapc, and then it talks about the members being a member. And then it says materials to bring: the current CPT manual, the ICD-10-CM, and the HCPCS Level 2. Exam recommendation. The Cpma examination is recommended for a certified coder or medical record auditor who has experience auditing physician services or significant coding experience and is well versed with a variety of different types of audits, including but not limited to E&M services. Auditing involves compliance and regulatory issues in its day-to-day work, and the examinee will be tested on these concepts in addition to coding, modifiers, NCCI usage, and more. And then it talks about maintaining the certification. Membership is required to be renewed annually, and 36 continuing education units must be submitted every 2 years for verification and authentication of expertise. For CEU requirements, visit the CEU page. And it says, it talks about the examination, the overall passing score is 70% or higher. And then the areas of study reflect the scores based on the number of questions. And then it talks about CEU submission. But I will stop here and say this. I have seen people who are brand new to medical coding with the CPCA still sit for this Cpma. And they think that having this is going to make them more marketable and it is going to get them a job faster or make more money. If you don't have experience, guys, this credential is not for you. This is meant for somebody who's had experience. You have to have the level of professional maturity in this field to reach certain credentials. Just because you can take them does not mean that you should. Okay, that's first of all. When you are brand new, take the time to get your experience. When it has been 2 years at least, that's when you can start looking at adding additional credentials, right? But I always say that even when you have all of these credentials mean absolutely nothing if you have not had the experience to go along with those credentials, okay? So that is something that you guys need to keep in mind. A lot of people think that this is something that's gonna make them look really good, it's gonna get them more money. Guys, it's not. When I'm telling you that when I'm looking at these job listings and I see them asking for one credential, that's it. And they have never said candidate must have multiple credentials to make more money. So I did my research. I did a search for jobs that were specifically asking for the Cpma. I came across 5 positions. 5 positions asking for the Cpma specifically on their list. But on this list of all these credentials that they were willing to accept, they were always asking for the main medical coding credentials, the CCS, the CCSP, or the CPC, okay? And for these positions, some people are taking the Certified Professional Medical Auditor as somebody that's supposed to be an educator. And other positions are asking that individual to actually do auditing on the practice encounters and things like that, or the records. So the thought process behind who does what and their thinking of what this credential holder should be able to do varies, okay? And so like I said, I only found a few that were specifically asking for this certification. Now, I want to read this one. This particular job listing, it says required qualifications: CPC or COC, CPMA, CIC, CCS, RHIA, RHIT, and or the CCSP certification. And then it says 1 to 3 years of hospital coding and or auditing experience, prior medical work related coding experience, completed coding instruction or coding training is preferred, maintain a level of understanding for ICD-10-CM, CPT, HCPCS, and then desired qualifications: knowledge of medical terminology, anatomy, and physiology, knowledge of hospital reimbursement guidelines is a plus, proficiency in Microsoft Office, especially Excel, prior experience with 835 and 837 is preferred. I have no idea what that is. Knowledge of working in multiple EMR systems, Epic experience is a plus. Ability to work in a flexible environment, adapting to change priorities. Ability to work independently as well as in a team setting. Must be able to organize workflow, prioritize tasks, and meet deadlines. Excellent organizational skills and strong attention to detail. Strong verbal and written communication skills. Culture fit. I guess that's a thing. The culture with this company embraces those that demonstrate a deep passion for solving the problems of healthcare with enthusiasm for building positive work relationships and working together as a team. But they are wanting the individual description. It says we are currently seeking a hospital coding auditor with a background in hospital coding, billing, and reimbursement guidelines. The auditor must have a comprehensive knowledge of medical terminology, coding, contractual agreements, and various payment methodologies. This position requires good time management skills and the ability to work independently. And then of course I went over all the things that they were willing to what other certifications they were willing to take. And this one is for a multi-specialty surgery coder, and it doesn't say in here that it wants that. I guess this one just kind of snuck in there. I just read that one. So yeah, and see, this one didn't even ask for it either. So maybe I was wrong. Maybe it's like more like 3 positions that we're asking specifically for that. Yeah, I think that may be the case. But guys, that's another thing too. When you're out there and you're thinking that you need to add on all of these other credentials, take a moment to look at the demand in your area for those particular credentials. Because if there's no demand for those credentials, why are you going to get them? Because it is only going to cost you more money. You have to get more continuing education units. You have to be able, and in some of these with AAPC, they are asking you to have specific continuing education units based on the more specialty credentials. Now, I don't know if the CPMA is required for that. Like if they have like specific ones, like you have to do that. I know for the one of them you have to have, and it may be this one, but I'm not sure. But there's a lot of these specialty credentials, and again, when it comes to getting the specialty credentials, really you do need to have experience. They say that it is strongly recommended, but they will still let people still take this exam anyway, because that's what they do at the end of the day when you're looking at these business models, right? And they have to get people, and they have to get them to get certified and things like that. And being certified is a good thing, right? It means that we can pass a standardized test and that our knowledge is enough to get into the field. But the rest of it is up to us once we start adding on these things. Now, if you've been a medical auditor, medical coding auditor along the way, if you've done audits for your facility, and you want to add this on because you've had experience and this is something that you really like to specialize in and do, then that is something that is different because you've had the experience to go along with that certification. So that's okay. And when you do things like that, that's going to make more sense. But when I see somebody who has a CPCA and then they have this CPMA and then they have all these other credentials, the CPB and all this other good stuff, it's like, okay, well, have you been taking the time to really learn what you're doing, what's going on actually? Have you had a lot of experience working in the clinic, educating providers? Because I think that that should be something, especially with things like this, if you're going to be auditing somebody, right? Or you're going to be auditing a facility and you're telling them, hey, you have errors here. There's errors here. And I see them because I'm an auditor and I'm looking at this and I'm telling you where you're wrong. You need to have the ability to be able to teach and the ability to be able to educate folks as to why they are wrong. Because, you know, when it comes to being the person who has to tell people that they're wrong, people are going to resent you for telling them that they're wrong. And they're going to get upset at you and they're going to think that, oh, well, no, you don't know. This is the way that we do it here. And if you're able to show them your reference, your official reference, then that is something that is going to be good for you because eventually it is going to help them. You have to be the bad guy, right? You have to be the bad guy when you are an auditor and when you're doing things like this. This stuff is serious, folks. This is not something to play with. What they're testing these folks on is pretty big. You know, when you look at the grand scheme of things and you're looking at these specialized credentials, really look at what they're asking of you. And really look in your area to see if this is what is asked for. If they're looking for this. Like I said, I only found a handful. And at that, not even all of them were asking for the CPMA. So think about that. If you're going to invest in anything and getting sharper and doing all of these things. Currently, I have one certification myself. Now, that will change in the future. But right now, I only have one. And I've done a lot of really good things with only one certification. And I get to keep more of my yearly salary because I only have one. And that's something else that you need to think about too. It's an expensive field, guys. Getting into health information, medical coding, it is a very expensive field. Not only do we have to keep up with our education and learning and continuing education units, sometimes we have to purchase books as well. And sometimes we have to purchase additional classes if we want to get sharper. Now, that's where you should invest more money. If you're going to invest in yourself and you want to get all these certifications, invest in additional medical terminology courses or an anatomy course or something that is going to help you to understand medical coding better. That's what you should do. But like I said, this certification, if you're looking at it, is meant for somebody who's had experience. If you're brand new, this is not for you just yet. Learn what you are going to learn in medical coding. Get your experience and get it in a variety of settings. Take a sampling of each place that you can, wherever you can get in, right? And like I said, when you have more experience, you're going to have more opportunities open up for you. At least that's just my advice anyway. But I will leave this link for the CPMA in the description box below. Again, I'm not endorsing this. I am just giving you guys information. And hopefully this will make sense to you because, of course, there's lots of options out there. And sometimes it helps to have somebody who can explain it, who is on the outside looking in, right? It's not somebody who has a vested interest in it. Okay, so I'm going to go ahead and wrap this one up. If you have found value in this, I hope you'll hit that like button. Subscribe if you haven't already. Share this video if it helped you because it may help somebody else. And I will see y'all on the next episode. Bye!